Hello. Over the past month, we at Raystone Senior Living have been working hard to adapt our services and communities to make them safer in the ongoing pandemic. And more recently, to respond to the challenges of heat, wildfires, and poor air quality. Let me begin by sharing some good news. First, we finalized a protocol for providing essential transportation services, which we will begin rolling out in September. Why begin rolling out and not just implement it everywhere at once? Because we need to make sure our protocols work to protect everyone. That said, we want to make sure it's as convenient as possible for residents to keep up with routine medical appointments, lab testing, and so forth. They can be vital to maintaining health. Our new transportation safety and sanitation measures are based on science and CDC guidelines, including the requirement that passengers wear a face mask at all times, along with our drivers. You'll receive the details when the service is about to begin at your community. Let's talk about dining. While in normal times, a highlight of our days. We will begin reopening dining rooms as soon as we can. A while back, we ordered plexiglass dividers for our tables, something like sneeze guards on a salad bar. Those materials turned out to be in high demand, so delivery has been delayed. But the good news is that we figured out how to make dining possible in all of our communities. We can't wait to have you back. A few months ago, I shared the good news that we hadn't had any cases of COVID-19 in our communities. I promised that we would tell you if any cases were identified, and we did reach out immediately to specific communities when cases occurred. Over the past weeks, a very small number of residents acquired the virus. 4 have recovered, and 1 is getting better at home, self-isolating. Sadly, 1 resident succumbed. Our hearts go out to their family and friends. The fact that these illnesses have been isolated and have not spread at any community demonstrate the changes we made to protect you and our team have worked. And yet, I know we're all tired of coping with the threat of coronavirus. We're awash in numbers, the positivity rate, the capacity of ICUs, the infection rate. There's an understandable temptation to tune it all out. If someone goes to the store or church without a mask and nothing bad happens, it might feel safer. I wish it was safe, but it is not. The numbers we hear are like crosswalk signs. When the little walking person comes on to indicate it's our turn to go, we still know to look both ways. We still have to be alert for traffic, for our own safety, and for that matter, for the safety of others. I remember pulling back on my son or daughter's hand more than once while in a crosswalk when I saw a driver who wasn't paying attention. Friends remind friends to physically distance and wear a mask when out and about. That goes double for our hallways and common areas because they're indoors, and the virus can live for several hours in the air. Things have improved in some counties, but cases are expected to spread again, unfortunately, as people enjoy Labor Day and some children return to school. So we can't let down our guards. At Raystone Senior Living, what makes us want to get up every day and go to work with enthusiasm is to bring warmth, engagement, and fun to your lives. But we can't ignore the traffic. So we're going to keep working hard to make life enjoyable while paying attention to things that are risky. Hang in there, stay safe, and hang tight while distancing with those you care about. Just knowing someone else cares can make a big difference in somebody's day.